Welcome back to the EIU podcast series on what do young urologists need to know. This is segment 3, where we discuss how to pursue academic excellence in urology. In this episode, we are joined by Alba Sierra Del Rio, urologist and specialist in endourology, laser treatment of lithiasis pathology and benign prostate hyperplasia in University Hospital in Barcelona, Spain, and Yasmin Abu-Ghanem, a consultant urological surgeon at Guy's and St. Thomas NHS Foundation Trust Hospital in London, United Kingdom. Together, they will discuss what you must know if you want to go on a fellowship. Join us as we embark on this informative journey.
I'm Alba, and I want to know something about fellowship, and that's why today I'm with Yasmin, because she did a fellowship, and we are going to ask and to reply some questions about her experience and also my experience in the past doing a fellowship.
So I'm Yasmin Abu-Ghanem. I'm a urology consultant at Guy's Hospital in London. And yes, I did the fellowship. It was a wonderful experience that I would love to share. And Alba and I will discuss a couple of questions that we've been asked since our fellowships and try to help you make a decision about your path. Let's start. Alba, you go first.
Yeah, so first of all, this is something that we want to share to you to know what must you know before doing a fellowship. Obviously, the first question would be, what is exactly a fellowship?
It's a good question. It's kind of defined training opportunities. It helps you gain more specialized experience in a subspecialty or sub-chosen area. As for example, in urology, which we're meeting today, if you specialize more in cancer or even more specifically, in my case, renal cancer, you get to experience only this field and get better in this very subspecialty. It's usually defined about 1 to 2 years. And the reason it is defined is basically to give you all the tools so you can go and grow as a consultant in your next job.
Okay, so following your explanation, I want to know if it's important super specialization nowadays, because you told that you are now specialized in renal cancer, but do you think it's important to go into this super specialization? We are not missing other things, or what's your point of view on that?
Well, it's a very good question, and it is a problem. We all know that in all fields of medicine, everything became very subspecialized. We even say in ophthalmology, we have a joke, left eye, right eye. Became very, very specific. And I think that most jobs now these days, we have general things, and if we specialize to our field, we all do a bit of general urology. So we all do a bit of everything. But we also, I think there's value of specializing. In my case, my subspecialty was kidney cancer. Now I specialize also in bladder cancer. And I think that once you focus your knowledge and your academia and the updates, because basically, if you're interested, for example, let's take something away from my world, andrology. Doing just andrology gives you skills. First of all, you do it more often. You understand, you read more about it, you understand everything that is up to date about it. And basically, it gives you tools to be better than an average person in that field. So if I needed an andrologist, I will go to someone who specialized in that, who knows how to do these things and learn from the best people, hence the fellowship, as opposed to someone who does it once in a blue moon.
I completely agree with you. And that's why I think that it's not enough to be just a neurologist. I think also that besides knowing a lot specialty, we need to focus on something concretely. I completely agree with you.
I mean, the beauty of urology, and my younger sister, Nora, bless her, she's starting to decide what she wants to do. And I told her, you have to become a urologist. And the reason is because we have so many subspecialties. I mean, we have oncology and andrology and endourology and pediatrics. So we have a lot to do and a lot to see. And even within, just like you said, Alba, even with these subspecialties, we have subspecialties. So it's brilliant because you get to focus, but also see all the other patients.
Yeah, in my hospital, people ask me if I'm worried about doing endourology all the time, but I say that no, I'm really committed to do that, and I'm really happy one. I think that when you know a lot of something, it's when it's getting more interest and you study about this, no, and you are focused doing these surgeries, you try to do it better. So I think that's the point also to go into super specialization, that you start to love more about this part.
Couldn't agree with you more. And as Europeans, you've probably been asked this a lot. Do I need it? Why do I need the fellowship? I can, stay here and do it with my colleagues, or you're a brilliant surgeon. And I'm sure that a lot of people can come in your trust and learn from you. And I think the main reason to do a fellowship, and that was my tool personally, is you get exposed to other approaches, to other surgical skills. Just do things differently. talk to patients differently. Systems work differently. So I was trained in Tel Aviv, and when I went to London, everything was different, and it was shocking, but it was fantastic. So many new things, and I brought new things with me. And I think the fellowships help not just you as a trainee, they're also the other hospitals you go to. So not only that you take something from the best and, learn from the best skills and learn from the best people, you get exposed to new things, systems, nursing skills, administrative things, and then you take it back home and you can build your own service or build your own skill set that is very unique. And that's the biggest advantage, I think.
See, it's a continuous learning, I guess. So when do you think it's the right time to make the decision to go into a fellowship? For an intern, maybe you decided the early beginning of the intern when you start the residency program, or do you think it's better to do it later?
That's a fantastic question. And I'll be honest with you, because I knew I was lucky. And I think you were very similar to me. I knew I want to do something with oncology. And I fell in love with kidney cancer quite early in my career. So it was I kind of had an idea that whatever happens, I'm probably going to be in kidney cancer. I'm probably going to do research. And then I fell in love with bladder cancer suddenly. And I thought, okay, I can incorporate this and do a lot of research in both. I'm fascinated. So I was lucky. But I know a lot of trainees who come to me and say, okay, I'm third year. In the UK, it's 7 years training, or back in Tel Aviv as well. So if they're coming to me and they say, I'm a third year, fourth year, I have no idea what I want to specialize in. And I always tell them, don't rush. You can always do a fellowship. See what you don't like. Eliminate. We have 5 subspecialties. I knew, and forgive me, my andrology friends, I knew I'm not going to do andrology whatsoever. So it was quite obvious for me.
Me too.
Alba is laughing. I think she felt the same.
Yes, definitely.
Sorry, andrology people, but I mean, we both knew it's not what we want to do day in, day out. And my best friend in training knew he was going to do stones. He was like, and now he fell in love with BPH as well. So he took a second fellowship and he went to specialized in new techniques in BPH. So I think don't rush. Take your time, enjoy the training, enjoy urology. I know it's hard to enjoy it when you're doing calls and everything else, but see which theaters you enjoy to go to. Once you make a decision, I can give you a side tip. The EAU has a program called the EUSP, the European Urology Scholarship Program, and they offer clinical visit and attachments. And you can go and you can say, for example, someone came to me the other day and said, I want to train, I want to do a bit of oncology, but general, not like the UK, very specialized. So she wanted to go to the NKI. So I suggested go do some research, know the team, see how they work, and then you can apply for a fellowship there and see if it works for you. You can't just move to the Netherlands without seeing these people before. And it's a great opportunity to start research projects and a lot of other things. And I think in a lot of academia. So that's another way to kind of get yourself familiarized with the idea of fellowship.
Yeah, actually in Spain, it's like 5 years for the intern program, like a residency program. And I did like this in my 4th year. I do a scholarship like 2 months. And then at least I think it's important with you. I agree with you that it's important to go before starting a fellowship of 1 or 2 years, to go there a little bit before, even a short time of period, to know how is it going, what are you going exactly to do, what to expect. It's really important. So yes, maybe the right time to make that decision, it should be in the residency program.
I completely agree. And I mean, the EAU is amazing with the fellowship. Please look, I mean, I'm advertising it now, but please look online. There's amazing opportunities for, rotation and clinical attachment and these things. Don't underestimate it. That would give you understanding. Is this what I want to do? And you'll be surprised how many people go for these. I mean, I did the year scholarship in London. I did a clinical study with a clinical trial with the kidney cancer team. And I love the team and I love how things are working in London. Obviously, I was stuck in COVID, but apart from that, it was wonderful. And obviously, it made me feel like, okay, this is a place I want to work in. I'm going to come and do my fellowship. So I completely agree with you, Alba. Go experience, see, and that will help you. You might actually eliminate places, and that will help you as well.
Yeah, that's right. Yeah.
So let me ask you a question, Alba. So you decided you want to do stones, and you knew that this is probably what you like the most. You don't like the major surgery and you can't deal with the oncology. You don't like it. That's fine. How did you choose which hospital to go to?
Yeah, actually, that was difficult, but I was looking at some courses online, and also in the European meeting, and I saw that Olivier Traxler was one of the most well-known endourologists, and I applied to go with him. I think that you need to see some courses, go also to visit some people, go to meetings, and maybe you will hear someone that really interests you and catch your attention. he catch my attention, I would say, and I applied to go with him into a fellowship. Well, into my clinical experience at the beginning, and then to do the fellowship with him too. So maybe it's important to go to meetings also during your residency program to visit some people and to decide where to go.
The same happened to me. I worked with Professor Bex in the EU guidelines, and I met him, and I liked the fact that he's very academic and everything he does. And I thought, okay, I want to try and experience working with this man. And I agree. I mean, obviously, there's other things. And I think that one of the things we always forget is a tip that I can tell you. Make sure, I'm sure that some of us has means, but those of us who don't have means, make sure that it's a paying fellowship if you need it. Don't assume that it's paid, because some places you go for the experience, but if you need to make sure that you're getting salary if you're working, or if you're doing it as, clinical observership, because if it's just observership, you may not have hands-on. So make sure that you understand what kind of fellowship you go with, that it's actual clinical fellowship and not another version. And I think that I have some colleagues who got fundings and grants. The same best friend who went to do BPH, he got, grant from the hospital, go learn the method and come back, which is fantastic. Because he knew he's not going to get paid in that specific fellowship. So check these things. You don't want to be excited, find a place, find a supervisor, and then find out that you can't live in, I don't know, Frankfurt for 6 months without money. So this is, I think, a very important thing.
Yeah, it's really important. I think that at the beginning, when you make the decision, this is quite difficult. But then when you take the decision, it's also important to know how are you going to be there, who is going to pay you. If you need to save money also before going there, you need to plan this with time. There are some grants. I don't know if you apply for a grant in the European Urology Association. There is a grant for fellowships.
Oh, that's fantastic.
You need also to prepare this because they ask you for a project. So it's something that you need to look into advance before going into a fellowship, because it will take like 1 year to get grants, even if it's not paid, I guess, because if it's paid, there is no problem. But if it's an unpaid fellowship, people should take at least 1 year to apply for grants and to know if they are going to receive.
I completely agree with you. And this is another important point, because I think personally that doing fellowship is more recommended to do it outside of your country, as I said before. Go learn new things and come back, because you're moving to a different country. Like you said, exactly, Alba. You need to find a house. You need to find, if you have partners or children or certain life circumstances, prepare, make sure that you know that you're going to disappear for a year or two. So don't think that in the last minute, because you're going to find yourself for a year not working. Because if you're going to do everything in the last minute of your training, and then you realize that you have to sort everything out while not getting an income, these things have happened to many, many people before. So towards the end of your fellowship, see what you like or what you don't like, get an idea of who you want to go with or who you want to apply, send emails. Many people ask me, so how do I do it? See what Alba did. So she said, okay, I want to go to this man. Alba, how did you do? Just drop him a line?
Yeah, I contact him online. It's easy. You can find there. Most of people, I think that they have like their emails online, or even in Twitter. You can send private message through Twitter, well, through X now, the social media. But yeah, I think it's quite easy to look for people who is working at least in Europe, and in the States, I guess it's also quite easy.
Yeah, I agree. I mean, most of the really, leading centers and leading people like Professor Traxler and others, I think all of them are very, very inclined to help and support trainees who want to come and learn. So it shouldn't be very difficult. I mean, I drop a line to Professor Bex as well. I did the same thing. So, and if someone doesn't answer you, don't be discouraged. Obviously, these are very, very busy people. So try again. I think that would be a very, very important note.
It is important, I think, also you find them in a meeting.
Yes.
To don't be shy. Even if they are professors and probably you are at that time an intern, but go there, ask them. I think you will surprise that people is super nice and people is open to have some visitors, that everyone is happy to have someone in their ORs or to spend some days with them.
I couldn't agree with you more. I mean, it's a massive compliment saying, I chose you, I want to come and learn from you. You don't have to do anything for me, I want to come and learn. And we have a lot of experience from a lot of people who did fellowships all over Europe who came with these great skills. In my experience, I mean, my colleague who did the fellowship now, he's running a service of kidney cancer in his hometown. One from Sweden, one from here from the UK. I mean, it's obviously helpful. I can see a lot of people who learned and done a lot thanks to that. So I agree. Don't be shy. Approach, talk.
And we talked that it's important to prepare this in advance, but do you think that it's also important to think what you are going to do afterwards when you came back with your fellowship?
Absolutely. Because, and this is really, really important, because a lot of us, and don't forget, when we go to fellowship, we're slightly a bit older. We're not medical students anymore. We're grown-ups. So yes, most of us maybe not have marriage and kids and stuff, but we have responsibilities and houses and money, etc. And realistically, most of us plan on going back to where we came from, to our own hospital, unless we want to move or we want to be free birds, which many people do. But the majority, let's put it this way, we need to have a plan. So if, for example, you were trained, what's the name of your center, Alba?
Hospital clinic.
Hospital clinic. So if you want to go back to there, but you like, endourology and this is what you want to do, it's okay if you say, I prefer to do something that I'm interested in and I'll look for a job later, no matter what. But you need to understand that if you want to go back to the same hospital and they already have 3 people specializing in that field, don't be crossed or don't be expected to be weighted with flowers come back with fellowship. It's very important. It's a very delicate balance, and I appreciate that. And when I went to do this fellowship, I knew that in my old hospital there was a lot of people doing cancer and a lot of people, and I was a bit concerned about this. And I had a long conversation with my boss saying, okay, I'm just going to be one of many. So even if you do give me my old job back, I might end up doing nothing because there's a lot of us. And it was a very difficult conversation. And lucky for me, we found a balance and we found what I'll do and the others do. And I think it's very important. Talk to your boss. If you, I don't know, in the UK, it's very versatile and they move from one hospital to another every year. But in other places like Spain, I'm guessing the training is in the same hospital throughout the 5 years. Go to your boss who knows you for the last 5 years, have an honest conversation. And if they say, look, we don't have a room for another endourologist, but this is what your heart wants, but you want to go back to your old hometown, I would start looking around in other hospitals. I would start asking other hospitals, okay, if I go to a fellowship, will you accommodate me back? Because you don't want to go for a year, get a skill, and you know that no one is waiting you on the other side if you want to come back. So I would plan it in a sensible way. Some people delay their fellowship, say, okay, I'll start doing X, Y, and Z in my old hospital because that's what they need now. And I'll go in a year or two to the fellowship, or the other way around. So liaise with your bosses, liaise with your colleagues, talk to people, and you might be surprised. It's actually because you don't want to just do something and then come back and say, okay, what am I going to do now?
Yeah, I completely agree with you. Also, I would say that it's important that even if you talk to everyone before going and to have some expectations when you came back to your hospital, I would say that the very first year, at least for me, the first year coming back after the fellowship was quite difficult because like I was thinking, okay, now I'm a specialized, I'm doing endourology, I have a fellowship, but then you realize that real practice is not that awesome every day. At the very beginning, you start doing some surgeries. I was not interested to do it.
Yeah, you do a lot of hydrocele in the first year.
But you will find your place afterwards. So don't rush. I would say that no, don't rush. When you have a fellowship, it's important in your curriculum. And then you need to take time. I was like looking amazing surgeries for a year doing my fellowship. And then in my real practice, they were not that awesome. But little in little, they were getting more interesting.
I absolutely agree. Please be patient. It's very hard because when you finish your training, you feel on top of the world. And then you're like, okay, I can do anything. I'm practically becoming a consultant now. I'm a senior doctor. And then you specialize and you come back and you're like, okay, I can do it. And then they give you junior things like hydrocele and stents. And you're like, what am I doing? I just went to the best place in Europe to train. And yes, this is what they give you because you have to start slow. And don't forget, when you come back from fellowship, you're the boss now of this operation. You're not a trainee where someone else is signing off for you. So get used to this position of being the one who's responsible. Get used to a lot of things that comes with this job and slowly show perseverance, show patience. You're going to learn that slowly, you're going to do more and more what you specialized in. Just be patient. I couldn't agree with you more, Alba. Don't get discouraged and you're like, what the hell is that? I went and did cystectomies for 12 months and now you're giving me hydrocele.
Yeah.
It's okay. Do the hydrocele. They're everything. Enjoy it. It's fun. You have the rest of your career do what you specialized in. Now, just take your time. Listen to people who've been there longer than you. I listen to people who've been there longer for me all the time. And it doesn't matter how long you're a consultant. I'm a very young consultant. Alba, you're as young as well. We've only been a few years, as a post-fellowship. I'm taking my time. I'm not expecting anything. I'm just enjoying the ride and learning a lot from my amazing colleagues. I'm learning so much. Even circumcision, you can learn how to do again if you're with someone else.
Yeah.
Trust me.
Yes.
Just enjoy the ride. Do you agree?
Yeah, I completely agree.
I mean, I'm lucky. I have the best colleagues in the world, but I suspect Alba feels the same about hers.
Yeah, no, definitely. No, it's important to hear everyone. And then you're back to your old hospital. So you need to take time and don't rush.
One last tip I can give you after we said how to find, basically, we told you how to find the fellowship, how to find what interests you. That's the hard one, but you will learn. As I said, many people I know did it by elimination. Don't like functional, don't like this, and ended up with something specific. You find the hospital, loved Alba's idea, go to meetings, listen to people, see who you find interesting, what they're doing. It's very important to do some academia in your career and find something that interests you, because then you're going to actually enjoy doing it, not just reading it. So that's a tip. Make sure the salary and the money and moving. Personal last tip I will give you, don't lose touch with the place you did your fellowship with. Don't lose touch. Keep in touch with these people. These are amazing people who give you amazing skills, taught you a lot. Stay in touch. The Americans do alumni's meeting. Royal Free in London do alumni's meeting. I think it's super important. These are people who's going to be your colleagues for life. And sometimes when you're stuck and you need an advice, these are the ones who can help you because they're the one who taught you. So don't lose touch with your teachers ever. Do you agree?
Yeah, I agree. Actually, when I was doing my fellowship on Tuesdays morning, I was like in a Zoom meeting every morning with my all department. I'm in France, but in my heart, I'm still in Barcelona. Don't forget me.
Exactly.
What do you think that are the benefits of the fellowship?
Well, personally, my personal experience was brilliant because the benefit was I did a brilliant fellowship, met amazing people, learned a lot of skills, and ended up staying in the UK. So, on my own personal level, it was fantastic because I was offered a position and I'm working here and learning so much every day. And on a professional level, I think primarily I saw other skills and other ways of operating. And I've learned a lot of things, even from the small cases. I've learned how people work and how people do things, and I love it and I embrace a lot. Like I told you, I learned something every day, even from circumcision. I took personally also the system. They have a wonderful thing that I love in the UK. It's called Cancer Nurse Specialist. And there's a lot of things that I really love to work with and I enjoy it. And I think I've learned a lot from this. I met incredible teachers, people that you can go and have a coffee with on the one hand, but also, give them a call when you're struggling in a difficult case. So it is a great benefit. And professionally, it just gives you more confidence. At first, you're scared. Don't worry. In the first couple of cases in your fellowship, you're going to feel like you don't know anything. Please don't feel like you know everything, because that's not the point of fellowship. The point of fellowship is a clean slate, start over and learn and listen. And it's going to be hard, as I said. You just finished training, you feel on top of the world. Take a deep breath, do what you need to do, and learn and listen. And I was lucky. I mean, Royal Free was brilliant and kind to me, and it wouldn't have happened if I wouldn't have come.
I agree with you that actually, no, one of the points of the fellowship was networking. You met a lot of people during the year that you are there. In my case, with Olivier Texter, there were a lot of pharma companies that came to our OR to introduce some new devices. And this was super nice.
And you see the newest gadgets as they come. It's quite cool.
I was like looking to them before they are in the market. So it was a great experience. Now, actually, I'm using some things that I saw for the first time 2 years ago.
Wow, that is amazing.
Yeah. So I think this is a super good point of being there. You saw so complex clinical cases, but obviously I agree with you that you are maybe not ready to do them, but at least you have seen them and you know a little bit how to manage them. And it helps you to get more confident and to
I agree.
do something step by step.
I completely agree. And when you see complex cases, yes, you're right. You can't manage them on your own, but you learn how they managed it in many, many layers, how they responded to it. Okay, what was the first response? How are they gonna, surgically management, medically management? And then when you ever encounter it in the future, like, oh, I've seen this case and this is what X, Y, and Z done. And if you go to fellowship and you go to highly specialized center, you see more and more of the extreme cases. And yes, you may not see it in your entire career, but you see something that resembles, and you can use this as a tool to other cases. And I think this is the best thing that you can do in a fellowship, especially in a highly specialized place.
Yeah, and also academic, no? Because you have like a whole year doing only in my case, urology, going to the OR, but I have also plenty of time to study and to write some papers and to do some research that now in my real practice is quite difficult to find the place to do this research.
Actually, I agree. I mean, I wrote like 3 or 4 papers during my fellowship. It was a very good time. It's not because you're going to have time. You're not going to have time. It's very intense. But it's good because you get exposed to many times to different databases or different kind of approaches. And if you are in a highly academic center as well, you're going to be kind of pushed in a positive way to do things. So take this advantage. You have a year of your life that you have to dedicate for your career in a significant way. Use the weekends to go travel around and dedicate time to professionally, I mean, clinically, surgically, but also academically to push myself, because once life starts after fellowship, it's really hard to start writing.
So I think that's all. I don't have any more questions.
So can I ask you a final question?
Yeah, sure.
What was the best part of your fellowship?
Meeting people. I met friends. They came over a lot of. There was one Greek guy coming for 6 months. There was also another fellowship with me. She was from Peru, and we are really so close friends now. Well, she's going to marry in a month, and I'm going to Peru to the wedding. So for me, this was also the best point, to meet people and make friends. It was a really good time.
That's actually quite remarkable. Yeah, I have to agree with you. I think the guy that I did the fellowship with me, Nick, he is probably, I mean, the fellowship itself is, but my favorite thing, because I earned a friend for life. It just changes it. It's like someone who's been through this journey with you and just become friends. And obviously, I'm a big fan of his. Great. I hope we help. If anyone, obviously, our emails are online. So if you need anything, and drop us a line and ask us any questions, we're happy to help. And good luck.
Yeah, good luck. And if you have any questions, don't hesitate to contact us, and we will try to help you as much as possible.
Perfect. Thank you.
Bye. Thank you.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.